Dr. Esma, every time someone hears tooth decay, they imagine a tiny cavity quietly minding its business. But today, today, we're pulling back the curtain. Because the real story hiding inside your mouth is way wilder than anyone thinks.
Exactly, Rasim. People assume tooth decay is slow, predictable, politely waiting for symptoms. But it's sneaky, far more aggressive, and it often begins long before anyone feels a thing. And the surprising part, most early decay looks perfectly harmless to the untrained eye.
That's why we're here, to reveal the twist nobody expects, because once you see what decay does behind the scenes, you'll never look at brushing the same way again. Buckle up, study, Dr. Esma, most people think tooth decay starts with some dramatic warning sign. But honestly, the real trouble begins in the quiet moments, like sipping a sweet drink at work or skipping floss, just this once. Those tiny habits feel harmless, yet they stack up fast.
Exactly, Rasim. And what makes it tricky is that decay often hides between teeth or beneath plaque where no one looks. Many patients tell me, but it doesn't hurt. And I always say, pain is the last thing to show up. By the time it hurts, decay has already traveled deeper.
So the real danger is the gap between what we feel and what's actually happening. It's like a silent countdown you never notice until it's too late. Dr. Esma, this matters way more than people realize, because decay isn't just about a tiny spot on a tooth, it's a chain reaction. One weak point becomes two, then spreads like dominoes, and suddenly that small issue turns into a bigger story.
Exactly, Rasim. I've seen patients who ignored a tiny shadow on an x-ray, thinking it was nothing. Months later, that shadow reached the nerve. Now we're talking sensitivity, swelling, and a much more complex procedure. The earlier we catch decay, the easier and gentler the solution is.
And the crazy part? Most people don't know these dramatic changes can happen silently. Which is why staying ahead of decay is almost like having a secret superpower for your smile. Dr. Esma, people are always shocked when they hear how common this is. I mean, almost everyone experiences some form of early decay without even knowing it. And honestly, when you hear that more than half of adults have untreated decay, it suddenly feels a lot closer to home.
Absolutely, Rasim. I had a patient recently. No pain, no complaints, just a routine check. But the x-ray showed a tiny shadow between two teeth. Within weeks, it grew enough that a simple fix turned into a deeper restorative treatment. That's how fast things can move when we can't see them.
And that's the part that hits hardest. The speed, the silence, the surprise. Early signs look boring, but the consequences definitely aren't. Dr. Esma, here's what people love about you. You make the science sound like a plot twist. So tell us, what's really happening on the microscopic level when decay starts its attack? Because it sounds like a slow burn, but the chemistry is moving fast.
Rasim, the science is fascinating. Bacteria feed on leftover carbohydrates and release acids. Those acids begin dissolving the enamel's mineral structure, almost like tiny raindrops slowly carving stone. Once the enamel weakens, pathways open for decay to move deeper toward the dentin, where progression accelerates. It's a biochemical chain reaction triggered by everyday habits.
So it's not just sugar equals cavities, it's a whole microscopic battlefield happening right after we eat. No wonder things escalate if we don't break that cycle. Alright, Dr. Esma, here comes everyone's favorite part, the actual game plan. Because once people know the enemy, they want the exact steps to stay ahead of it. So walk us through it like a cheat sheet for a healthier smile.
Of course, Rasim. Step 1. Fluoride toothpaste twice a day. Fluoride strengthens enamel and slows down acid damage. Step 2. Daily flossing to remove the hidden debris bacteria. Adore. Step 3. Rinsing after sugary or acidic snacks. Step 4. Regular checkups so we can catch early decay before it grows. And Step 5. Limit frequent grazing because constant snacking keeps the acid cycle alive.
Clear, doable, and powerful. A tiny routine shift and suddenly decay loses its advantage. Dr. Esma, this is where people usually say, okay, I'm doing the basics. What should I absolutely avoid? Because the tiny missteps often undo all the good habits. Give us the red flags, the deal breakers, the must-not-do list.
Gladly, Rasim. First, don't sip sugary or acidic drinks throughout the day. The constant exposure keeps enamel under non-stop attack. Second, don't brush aggressively. It wears enamel faster than people think. Third, don't skip flossing even once because decay often starts in those untouched spaces. And fourth, don't rely on mouthwash alone. It's supportive, not a replacement for brushing and flossing.
So the rule is simple. Protect the enamel, break the acid cycle, and stop giving decay a place to hide.